Hey guys, Dr. Clayton Roach from Roach Chiropractic Center, and today I want to talk to you about a concern or a problem that your medical doctor may have with you seeing a chiropractor. Now, many times I have patients that'll say, I want to refer so-and-so, but she needs to talk with their medical doctor. Now, typically I'll know where the discussion is going to go, specifically if people are one of three categories. One, if they have a lot of osteoarthritis. Two, if they're osteoporotic. Or three, if they're young or newborn or children. Now, the problem with osteoarthritis is one that doctors may have with you seeing a chiropractor. Now, you got to realize that medical doctors don't fully understand, just like I don't fully understand some of the procedures that they do. They don't fully understand or grasp some of the things that as chiropractors that we do. Now, sometimes they take it for granted that we do the same thing for every new patient that we have. So for the example of an osteoarthritic patient, they might have concerns because the patient might have bone spurs, and they're thinking that we're just going to deliver a regular adjustment on those people and not really take into consideration the extent or severity of the osteoarthritis. You have to be aware that as a chiropractor, we have more hours in radiology than medical doctors do. So we are fully aware of what's on an x-ray, the impact it can have, and that's why there are different techniques within chiropractic that we can use in order to deliver a safe and effective adjustments for those people. Now, the other concern is when people have osteoporosis. Now, I'm sure you know that osteoporosis is not a fun thing, and it basically affects more women and affects your bones' ability to become dense and strong. So what happens, you're more at risk of a fracture. So all of a sudden, if a medical doctor sees a patient who wants to see a chiropractor and they're osteoporotic, of course, a medical doctor is going to be worried because, again, if they think that we do the same thing for every new patient, they're not going to want their patient to see a chiropractor if they're osteoporotic, thinking that we're going to deliver a forceful adjustment. Now, obviously, again, because we have different techniques, we can adapt to a person that's osteoporotic and use an instrument tool. So we use that tool called the activator, and the activator is a little clicker that is able to deliver an effective adjustment and get great results for people that have osteoporosis. My oldest patient is 94 years old. She does have osteoporosis, and if I didn't have that tool, I would not be able to take care of her. So that's something that sometimes medical doctors do not understand or do not know, so they need to be educated. But unfortunately, not all chiropractors can get in touch with all medical doctors. So if you're a patient that's going to see their doctor and asking to see a chiropractor, if you have osteoporosis, chances are good they're not going to recommend chiropractic. The other scenario is if there's a newborn or a child. Again, medical doctors might not be up on the research about chiropractic and the effects on newborn, specifically children and adolescents, and the impact it can have on their lives. So again, with those patients, there are many different things that we can do, such as cranial work, using light touch techniques, specifically with a newborn. I mean, with a newborn, we're using about the pressure that wouldn't even hurt your eye. So if you're pushing on your eye, that's about as much pressure that we use on the spine, and it's more than enough to create a change in that spine and that physiology and the neurology for the newborn, because they haven't had the problem as long as us adults have had problems, such as 35, 40, 50 years of problems. So again, if you're going to see your medical doctor for advice on whether or not you should see a chiropractor and you fall into one of those three categories, osteoarthritis, osteoporosis, or you're going to see regarding your newborn or your son or daughter if they should see a chiropractor, be aware that your medical doctor might not have all the information they need in order to render an educated opinion on whether or not you should see a chiropractor. That said, have a great day. Look forward to seeing you soon. If you love our videos, make sure you share them, hit the share button, share them on Facebook, and make sure that we basically propel to the world that there is another solution called chiropractic. Take care.